People with eating disorder are at higher risk of suicide and medical condition. They go through mental health concerns like depression, anxiety, stress, body image issues, etc. Do not worry, recovery is possible with appropriate treatment and support. Hello everyone, I am Meghna Mohan, counseling psychologist at TalktoAngel. Welcome to our YouTube channel series on clinical disorder, episode 5, eating disorder and treatment. Today we have Dr. R.K. Suri, who is a clinical psychologist at TalktoAngel, and he'll be discussing about eating disorder. So sir, my first question is eating disorder a mental health concern?
Yes, eating disorder is a primary mental health concern because it impacts many of the young adolescents. As rightly put across by you, it causes anxiety, depression, as well as body image issue, then body dysmorphia and other related issues of the mental health. So it is a mental health condition which can be treated very well, provided the patient is taking appropriate steps or family member are also taking an appropriate steps for its treatment.
Okay, alright. So my next question is, what are the eating issues faced by kids and teenagers nowadays?
Today in the digital world, almost all the children and young adolescents, particularly in the teenage and the young adults, are very much hooked to social media. They scroll the Insta profile so regularly, making it a concern for them in terms of their diet, in terms of their appearance, body image, etc. And then they are very, very conscious in terms of what to eat, what not to eat. Also conscious about the diet. So these are eating concerns, but not disorders. 2% of young adolescents in India are having a eating disorder. And it has been recently found that 3% of female adolescents have eating disorder. Now, there are different types of eating disorder. The most common is anorexia nervosa. Person think that if he eats, he will become fat, and accordingly there is a consistent resistance not to eat the food as per the requirement of the body, and that causes a lot of anxiety to a concerned individual. The second eating disorder, most commonly known as Bulimia, in which binge eating is being carried out, but again become conscious that I will gain overweight. Now this is again a very major concern. There are other disorders, eating disorders like binge eating or purging eating, and recently I had one case from the Europe wherein the girl is having a weight of 36, and she is having a major concern that I'm not able to increase my weight, and the stress causes loss of appetite. Now when I explored deeper into the case, after having a couple of sessions, we came to know that there are two major issues which were evolving in her. One was the relationship issues. She had a lot of insecurity that her partner may leave. The other is the stress emanating from the workplace. Stress is the post-traumatic stress disorder emanating from the trauma which she has gone through while she was studying. Now, in the young adults, these are the most common eating disorder. The other issues in the children, particularly children, has a picky eating behavior. They are very, very choosy that they will eat X thing and they will not Y thing. And mothers are running after the kids in terms of the feeding because they think that the child has not eaten properly. Now, the basic recommendation of many of the pediatricians with whom I have a discussions, they say that leave the child. Don't run after the child in terms of engage him into activity. After the activity, then the child is tired, keep the food in front of him, he will eat it. But if you try to overfeed him, he will have a resistance to the food. And the eating patterns, eating habits start coming early in the childhood. And the dietary issues also come early in the childhood. There are families wherein they try to inculcate eating as one of the very good habits. That's why in most of the families in India, particularly the Hindu families, a practice called as anprashan, wherein the child is made to eat the cereals, and there is a celebration in the family to the eating pattern. Now, You have to ensure that the child or the young adolescent eat the food as per the prescribed requirement of the body. Normally, eating is also linked with the good height as well as the BMI. These all things needs to be considered. Now, the reasons for eating disorders and eating concerns many times has a psychological characteristics or psychological factors which are determining the eating patterns.
Thank you, sir. This was very informative. I got to know a lot about our Indian culture, like what sir mentioned about Annaprashan. So this was very informative. Now moving on to our next question. What is the difference between eating disorder and eating concern?
The eating concerns sometimes is for eating less and sometimes it is for eating too much. So when eating too much comes in the form of that one is not able to control himself or herself, then it is an excessive eating. There are diagnostic criteria as per the APA, American Psychiatric Association, DSM-5. Based upon that, as I mentioned, the disorders are categorized as the Anorexia nervosa, Bulimia, binge eating, and couple of other disorders. Now, all those eating concerns are not eating disorder. If you visit somebody's house and you are a vegetarian and you are being offered a non-veg food, that's also eating concern. For making a matchmaking also, this eating habit and eating concern is a criteria. As I mentioned, eating is one of the fundamental habits of every individual and we have to respect it. And we should not consider it as a psychological disorder. It becomes a disorder when one is not able to handle it and manage their operations, or it is becoming overwhelming and impacting their daily functioning and functioning in the society or workplace. So eating concern is fine. You need to address them, resolve them and solve them.
Thank you so much, sir. This was very informative. I got a clarity and I understood about the difference between eating disorder and eating concern. So now moving on to next question. What are some parenting tips that you can give on eating disorder?
Meghna, first and foremost, I would suggest you to seek a professional help. The first point of contact would be a pediatrician. The second point of contact would be a dietitian. The third point of contact would be a psychologist, child psychologist, who could provide the parents as well as counseling to the child, which would be very helpful in terms of the eating issues and concerns to be resolved. Besides that, it is also suggested that you should define certain specific time for it, demonstrate to the child how it should be eaten, and you should also fix up a dining table time that will help the child to learn not only the eating but also how to interact while having a meal time. The other things which needs to be taken up, don't talk about weight, don't talk about that you are becoming too fatty or you are becoming too skinny. Now all these things becomes a stigma. Many of the eating concerns leads to anxiety and depression. So we need to have a professional help. Reach out to TalktoAngel and seek professional help with our child specialist.
Thank you so much, sir. This was quite insightful. See you in the next episode.